I want you to bullet out your symptoms. So if it's weight gain, hair loss, constipation, brain fog, joint pain, whatever it is, list that out. And then you say, okay, doc, here's what I really want to have tested because I want to get that full picture of what's going on in my body. Many of my symptoms that you see listed here are very much correlated to low thyroid function. So we want to test everything so we can work together and see what the next best step is for me to have a higher quality of life and not deal with all of these symptoms over here.
Did you know that around 12% of Americans, this means roughly 30 million people in the United States, will experience a thyroid condition in their lifetime? And right now in 2025, 7.6% of adults, or 20 million, currently have a thyroid disease. And there are 7.6% higher rates in women and 15.4% higher rates for women over the age of 60. Hormonal issues like hypothyroidism affects 5 to 10% of the population, and subclinical cases push that percentage up to 20%. Autoimmune disorders like Hashimoto's and iodine deficiencies are often key drivers of those states of dis-ease. So we are all about helping you take back control of your health. And that's why I've invited my friend, Amie Hornaman, the thyroid fixer, to help us dive into all things about thyroid health and thyroid health optimization. My name is Jessica McNaughton. I'm coming at you hot with this exciting interview and update from Dr. Amie Hornaman. Let's get into it.
Power in your purpose, the C60 way.
Dr. Amie Hornaman, the thyroid fixer. So great to see you, my friend. Thanks for joining me today to talk about all things thyroid health.
Well, that's what I love to talk about. So we will have a fantastic conversation for your listeners.
I can't wait. All right, let's just dive right in. Can you please tell us a little bit about your background and how you became so passionate and interested in all things thyroid health?
So like a lot of people out there, and we see this in my listeners, in the patients that come to the clinic, we see so many people being misdiagnosed. And that was me. And this is back in my 20s. I was gaining weight rapidly, had all the symptoms, hair was falling out, I was fatigued, and I did what we all do. I went to my doctor. And I went to 6 of them actually, and they ran some tests. God knows what the tests were back then. I wasn't in this world to know what to ask for. So I just went in and said, hey, these are my symptoms. What's happening with my body? It feels like it's rebelling against me. And they ran some tests and they said, well, you're normal. You're normal. Everything is fine. And a couple of them actually told me to eat less and exercise more, which was ridiculous because I would literally bring in my diet. It was chicken, broccoli, asparagus. I was going to the gym twice a day. They could see what I was doing and how I was treating my body, and yet they just totally dismissed me. So we call that now medical gaslighting. And I was in the full experience of all the medical gaslighting out there. So it really wasn't until I found functional medicine that I discovered I had a thyroid problem and was actually put on the right path for healing and proper treatment. Because conventional medicine, even when they find something, they do this whole thing of, well, we're only going to test one marker. We're only going to give you one medication. The 99% of the time doesn't even work. Good luck. Hope you lose that weight. Hope you feel better. We'll check you in 6 months. And that just is totally unacceptable to me. So when I found functional medicine and I found the answers that I was looking for, I knew at that point in time, I also had to change careers so I could better help other people going through the same thing.
Why is the thyroid so important? For people that don't know, can you just break it down? I kind of want to do thyroid 101.
Yeah, I know. And it's so important. It's like I talk about this so much, but yet I still get these questions even from my community. I'm like, wow, we just need to talk about this, scream it from the rooftops
Yeah.
so that people understand that the thyroid is the master gland. So the thyroid is the master gland. It literally runs your entire body. It runs every single cell in your body. Every cell has a receptor site on it for thyroid hormone, specifically T3. And it dictates whether or not you have a metabolism, whether or not you're going to burn fat, whether or not you're going to turn your food into energy, whether or not you have energy through the day just to get through your day, your hair growth, your heart rate, your body temperature control, your glucose control, your cholesterol regulation, all of that is dictated by the thyroid. So it's crazy to me that we don't focus more on this master gland as kind of the root cause of many different symptoms going on in the body, because it does run the entire body.
Yeah, that makes sense. So, for people that just don't know, what are some of the key indicators, or let's say red flags, if you will, that you might have a thyroid issue? And if you wouldn't mind, Amie, can you do like what women would see and what men would see?
Yeah, absolutely. So, great question, because as I always say, the symptoms that your body is giving you are signs, and they are literally gifts, 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 presents given by your body to you to say, hey, there's something going on. Don't ignore us. We're waving the red flag here. Maybe look a little bit deeper. Now, hypothyroidism it does affect women more than men. And this is because men have that extra layer of protection by having really nice, adequate levels of testosterone. Now, with men with Hashimoto's or men with hypothyroidism, when they do get hit, ultimately it starts affecting their sex hormones. So men will notice all the same signs and symptoms that women will. They'll notice the weight gain, they'll notice the fatigue, the constipation, the brain fog, anxiety, depression, mood swings, maybe a little bit of AFib or tachycardia, elevated heart rate, deep depressed heart rate, fluctuations in their glucose, possibly diagnosed with hypertension. Maybe they're on a blood pressure medication. Maybe they're on a Band-Aid antidepressant. They're on a Band-Aid statin. But ultimately, it will start to affect a dude's testosterone levels. And that's where he's going to get the erectile dysfunction and loss of libido, the excess belly fat, the mood changes, where basically men who lose their testosterone, they become grumpy old men. That's why we have the term grumpy old men, because as a man ages, if he doesn't replace that testosterone, take care of himself, and look at his thyroid, he's going to become more grumpy. So those are the classic signs and symptoms for a man. All the things I just mentioned, minus the erectile dysfunction, can come over here to a woman. So she will notice the weight gain, the inability to lose weight, the brain fog. She'll say, I think I'm getting early stage dementia. Her hair will be falling out or breaking. Her nails will be all rugged, almost like lines in her nails, and they'll break very, very easily. Dry skin, loss of the outer corners of your eyebrows, cold intolerance, heat intolerance. I mean, just all the symptoms are very, very similar between men and women. Just the difference with men is that I see it hit their testosterone, and wow, do they notice it.
Okay. So you've just mentioned it's affecting men's testosterone if the thyroid is out of whack. How is it affecting all of our hormones?
Well, it definitely is. So oftentimes we'll see women go into an early perimenopause, menopause, because it starts tanking her hormones. Since the thyroid is the master gland, the master controller, it's literally controlling the dials of your estrogen, progesterone, and testosterone. So where a woman might lose her progesterone naturally in her 30s, definitely 40s, that's when we start to see it decline. And this was the case for me. So I'm backing up into my 20s. We also might see a woman have something called polycystic ovarian syndrome, which the classic component of that is insulin resistance and low progesterone. Now, my thyroid issue came first, followed by the PCOS. So yes, in my 20s, I had very low progesterone levels. I did not have the elevated androgen levels associated with PCOS, but I did have the insulin resistance and the weight gain associated with that. So we might see a woman lose her progesterone very, very early on. Then what we see with that, infertility issues, miscarriage, we'll see heavy cycles, PMDD, PMS increase. And you know what they do? They just give these women birth control instead of going back and actually looking at thyroid function and seeing, is that the main cause? Is that the main trigger for tanking this woman's progesterone in her 20s? Then we move into perimenopause, menopause. Many women will go into menopause early. They'll notice low testosterone levels as well as early in their 30s and 40s. So that's going to affect their muscle gains, their body composition, their motivation, their drive, their libido. So yeah, we absolutely do see it hit the sex hormones as well.
So how is it affecting metabolism specifically? Because you mentioned weight gain.
Oh yeah. If your thyroid's not working, there is nothing you can do to lose the weight. I'm sorry, I don't care how many detoxes, gut healing protocols, supplements, whatever you're doing, workouts, diets, fasting, counting your macros, all the things, it's not going to work because literally the thyroid gland and specifically T3 thyroid hormone, that is what determines whether or not you are burning stored body fat, determines whether or not you're turning your food into energy, determines whether or not you have a metabolism. So let me back up. The thyroid gland produces 4 thyroid hormones, T1, 2, 3, and 4. T3 and T4, what we test in the medical community, we can test it on a lab. We can see what your actual numbers are. And when we're looking at those 2 hormones, T4 is inactive, totally and completely inactive. It has to become T3 to actually get to the cell to do its job of whatever the job it is that it's doing. So in relationship to metabolism and fat burning, you have to have enough T3 on board in your body produced by your thyroid gland, or that T4, the inactive, better convert over into T3. And that's a really hard job to do. So you better be taking T3, you better be making enough T3, you better be converting your T4 to T3 if you have any kind of hope at having a metabolism.
I'm going to ask you this question from the space of my own personal experience. For years, in my 20s and 30s, I would go to my regular primary care provider, and he would just say, yeah, I get all the blood work. And he would say, Jess, you have a sluggish thyroid, but it's in the quote unquote normal range.
Yeah.
So, but he never said once, nor did my OBGYN, not a single one time, hey, did you know you need to have an optimized thyroid in order to sustain a pregnancy? So I had to learn this the hard way through miscarriages, that in fact, it's very important. So can we just talk about kind of like what's missing in like conventional, traditional allopathic medicine when you go to your regular doctor that you can, that's covered on your insurance? Like why is this information getting missed? What are they not testing for?
Well, yeah, you said it. So it starts with the testing. So first of all, you have to realize that your conventional medicine doctor, your PCP, your OBGYN, they are still dictated by the machine that is the insurance company. And listen, insurance companies, big pharma, I don't care what you believe, don't believe, that's big money right there. And they're dictating. This is why you only have a 5 to 7 minute visit every time you go in and you're getting pushed out the door.
Yeah.
Because they need to stack those patients to run it through insurance to make money, essentially. So if the insurance company says, listen, we don't want you running all of these tests that cost us money. You don't really need all of those tests, right? You just need TSH and maybe a free T4. You can throw that in there. And then just like you learned in med school, who, by the way, med schools are highly funded by big pharma. So there's always that wink, wink, nod, nod. You do realize that you are teaching your doctors, says the makers of Thyroid, to make sure that they know that all they have to do is test TSH. And if TSH is above a 4.5, you give them Synthroid. And that's all they need. And that is entirely, completely wrong. So that's where the first problem starts, is insurance is dictating what these doctors can run. Second is, if the doctors don't know what the hell they're looking at, they're not going to run a test. And 9 times out of 10, conventional medicine has not been taught to look at free T3, the active thyroid hormone. 9 times out of 10, 9.9 times out of 10, they don't test reverse T3 because they don't have a clue what that even means in the world of thyroid. So they're not going to check that. And then they'll check your TPO and your TGA antibodies for Hashimoto's. And if one time you come back within normal range, then you're done. They're never going to test you again. They go, oh, you don't have Hashimoto's. Well, wait a minute. That test comes back as a false negative quite often. We need to retest that, and we need to sit with a person for longer than 5 minutes, ask them their family history. Does mom, grandma, auntie have Hashimoto's or have any autoimmune condition whatsoever? Yeah, well, then I'm sorry, even though this came back at 0, chances are your hypothyroidism is autoimmune. It's Hashimoto's because there's a strong genetic component. There's so much missing in our conventional system. It's sickening. And this is why women still today, even I had my thyroid problem 27 years ago. I see the same damn thing happening right now.
Yeah.
It's gotten no better whatsoever. It may have even gotten worse because I remember back in the day, I think we got like a 15-minute visit and you weren't being, pushed out the door by the next patient walking into the room that you're in. It's crazy.
Really, my intent here is to help arm our community with information so they can ask better questions, so they can be a better advocate for themselves, right? So you're saying they're testing for TSH. What specifically, when you go in and you want to do the full range of tests for T3 and T4, what specifically should people be asking for testing?
Yes. So here's what I want you to do. And this is a great way to test your doctor too. So you're going to write these tests down. You want TSH, you want free T4. They're going to test that anyways. Then you want free T3, you want reverse T3, and you want TPO and TG antibodies, thyroid peroxidase and thyroglobulin antibodies. You want to write that down. And then on the other side of that piece of paper, all I want you to do is bullet point your symptoms. Do not write a book. Do not write your life story. Do not write a paragraph. They will not read it. I want you to bullet out your symptoms. So if it's weight gain, hair loss, constipation, brain fog, joint pain, whatever it is, list that out. And then you say, okay, doc, here's what I really want to have tested because I want to get that full picture of what's going on in my body. Many of my symptoms that you see listed here are very much correlated to low thyroid function. So we want to test everything so we can work together and see what the next best step is for me to have a higher quality of life and not deal with all of these symptoms over here. If your doctor says no to testing, it is time to get a new doctor because it is no money. It's important that you know this. It is no money out of their pocket to write a few extra labs on that piece of paper. It's you and your insurance company that's flipping the bill for the labs.
Right.
So it's not coming out of their pocket whatsoever. So if they say no, that's basically like in another language to you saying, I'm sorry, Jess, I don't know what I'm doing. And I don't know how to treat your thyroid. So I literally can't order these tests because at the end of the day, I can't help you. And that's essentially what they're saying. So take what they're saying and believe it and move on and find somebody who can help you.
Yeah, that exact circumstance that you just painted a picture of has occurred with me. I went in, I asked my doctor for this. I also asked, hey, if I'm working in conjunction with the functional medicine doctor, trying to resolve this infertility, question mark. And the reason why I haven't been able to move through with a full pregnancy, like, would you be willing to partner with this person to help me as I'm on my, wellness journey to optimizing my health? And the response literally was like, no, we just have different schools of thought. And so then I was like, thank you for your time. I'm going to go. They call, would you like to make another appointment? No, I would not. I'm not coming back.
No.
So in my opinion, it's a bit of a slippery slope because when you start doing your own research and you become armed with more information than your doctors have, because they just can't keep up. I mean, let's be honest, it takes a special breed of doctor to stay on the leading edge, the cutting edge, and to continue to learn and lean into all of the advancements in technology and wellness that have occurred, especially over the last 5 years. I mean, the landscape is just wildly different right now. It takes somebody who can, kind of park their ego on the side and want to be a lifelong learner to do the best and to do no harm. So that's really interesting. So if you have that experience like I had and you want to go find a new provider who is really aligned with helping you to identify root cause of what is affecting you, whether it be thyroid or any other health related issue that you're dealing with, in your opinion, what are some of the best questions to ask? And if you were to use AI or get on Google, to do your search, what are some of the key criteria that you think people should be looking for in finding an advocate that will work with them to help?
Oh, this is good.
Help dive into these root cause issues.
Awesome. Okay. So whether you are going the conventional medicine route or the functional medicine integrative route,
Or maybe
these
a
are really,
hybrid, right?
yeah, do a hybrid if your doctor isn't like your doctor, Jess, and just completely refuses, which a lot of them do get a little bit, they get defensive. Like, how dare you tell me that what I learned in med school is not true? When in reality, 50% of what they learned in med school has become obsolete the year after they left. Like you have to stay on top of things, but I'm diverting here. Whether you're going the conventional route because you really, really, really want to have your insurance cover it, it might be a long process. You might waste a year or so of your life, and you might find that diamond in the rough. Don't know. But the very first thing, of course, is the testing, like we talked about. And then if you get past that barrier, because over in functional medicine, well, I should actually caveat this. So if you're working with a functional practitioner and you just rely on them, you go, well, they're functional or they're integrative and they for sure will know what tests to run, and you get your labs back and you don't see all the tests on there, just don't try to beg them for the test. Don't waste your money anymore. Like, they literally don't know what they're doing. Meaning, I just looked at a colleague's lab panel that she's working with, a functional doctor. I'll use air quotes here. And he did not test reverse T3. And I'm like, so he doesn't know what he's doing with the thyroid. That's okay. Use him for your gut healing and, your parasite cleansing, and just realize that you're not going to get thyroid help with him because he has you on natural desiccated thyroid, which is 80% T4, and he's not even checking to see if you convert. So you want to make sure that all the tests are done first and foremost. And then what you want to do is start asking questions even before you drop money and start going down the functional route. You want to ask questions like, what medications do you use? What thyroid hormone replacement do you use? And you want to hear, hey, listen, anything that's going to work for you. We'll do compounded, we'll do Armour thyroid, we'll do NP thyroid, we'll do Synthroid, we'll do Tirosint, we'll do liothyronine, Cytomel. We'll do any combination that's going to work for you, because that's my answer. When I get asked that question, the thyroid hormone replacement that we put you on is going to be the one that works for you and the combination that works for you and the dose that works for you. I don't care what that looks like. I'm not, and my clinic is not blinded to, we're only going to use natural desiccated thyroid because it has the word natural in it. Or we're only going to compound it because that's the best. Actually, no, it's not when it comes to thyroid medication. It's horrible. So what we want to do is find that combination that's going to get you to that optimized state. If you're calling around and they go, well, yes, we use NDT. Okay, well, do you use T3? Oh, no, we don't do that. Okay, red flag, leave. You want to ask them if they have a certain amount, like a cap. They go, what do you mean? Well, like, what if I were to need, just hypothetically, if we were to be working together and you found out that I need 100 micrograms of T3 daily, because my friend's on that, she's doing great. Is that a problem? Oh my gosh, don't you know that you're going to get a heart attack if you go over 60 micrograms a day? Okay, well, thank you. I appreciate your honesty. Click, move on, because that's completely false. And that tells you that they have not updated any of their knowledge in the last 10 years. And they're going to hold you to a certain level where you might not be optimized. So that's another red flag. So you want to just kind of ask these questions really, and don't be afraid. Do not think that you're going to offend the person on the phone that you're talking to. It is their job, if you're paying them, it is their job to answer all of your questions before you hand over money.
If you identify that you've got a thyroid problem, hyper or hypo, why is working with the thyroid specialist critical?
Because it's so nuanced. And I see this more and more too. We have a big Facebook group, Just Fix Your Thyroid Facebook group, and that's to the public. People will post their labs and their experiences and their medications that they're on, looking for help. And we're jumping in there, guiding them. And I see this all the time. I see this over and over again, that it's kind of like the same protocol. And I'm even seeing these online telehealth clinics popping up where they use an algorithm to determine what you need for your thyroid medication. And while AI and algorithms and all the science that we have is fantastic in many different areas, the bottom line is that the thyroid and thyroid treatment and thyroid optimization is very nuanced, and you are not a computer and you're not an algorithm. You need somebody that knows what they're doing, pulling those dials and pulling the levers and changing the dials and really tweaking it to customize it for you. And I've seen those algorithms and I've seen the outputs of them, because I've been asked to look at a couple and I go, well, what if someone has a reverse T3 problem? This is going to screw them over. They're going to feel worse.
Yeah.
They go, well, that's so small. I'm like, no, it's actually not. It's a huge percentage of the population. So it's because the thyroid is a nuanced gland. It's a nuanced art to get someone optimized.
Okay. Can you please explain how the thyroid supports energy production?
Ooh, yeah. So just like, how we talked on my podcast about C60 actually working at the cell level, right? And when we optimize the cell, we make it healthy again, we make it functioning again. That powerhouse of the cell, the mitochondria, I like how you said it, a cell within a cell. That's a great way to think about it. Like your mitochondria is within your cell, and that mitochondria produces ATP. So just like C60 can help with that production of ATP, optimal thyroid can help with the production of ATP. And again, it comes back to thyroid hormone receptors. Think of like a little lock and key, like you have a lock on your receptor and the key has to fit into it and turn in order to do XYZ, whether it's give you metabolism, give you energy, light up your brain, let you poop every day, all the things. So it has to
Did you
have
just say
that
light
key.
up your poop every day?
No, let you poop every day.
Oh.
Light up your brain, and then it lets you poop every day.
Okay, let you
Which we
poop.
need for detox, right? If we're not pooping, we're not
Absolutely. You gotta
detoxing.
poop.
So we
Okay,
have to
all
have
right.
that, right? So yeah, it's very, very similar to how C60 acts on the cell. Thyroid hormone acts on the cell, turns it on, lights it up, and now your body can actually do what it's supposed to do.
Okay. So, in terms of diet and lifestyle choices, because I always want to know kind of what is the easy, natural path that you can go to start supporting your body. To me, it's like fix your lifestyle first and then dive into optimizing with supplements and medications and things like that. But in terms of diet and lifestyle choices, what are some of the most supportive food and lifestyle choices people can make to support a healthy thyroid?
Well, it's the no-brainer stuff that you and I live every day, but I do think that it helps to say it over and over again. Eliminating the processed foods, reducing the sugar. We know sugar is super inflammatory and really it basically just damages the cell.
Yeah.
And when you're talking about oxidative stress, again, I'm going to reference when you were on my podcast, you said it's like rust. And that's what oxidative stress is. It's rusting us internally from the inside out. So whatever we can do to take down that inflammation, we do it, and it's going to help the whole entire body work better. So yes, low sugar, no processed foods, elimination of seed oils, which we know are so damaging to the body and to our cell function. Now, for the thyroid specifically, it's about more elimination. So we don't want to be doing a large amount of soy products. The tofu, the edamame, we see a boatload of hypothyroidism in vegans and vegetarians because they're relying on that as a protein source. Soy milk, soy protein is hugely detrimental to the thyroid gland in large
Doesn't it
amounts.
just completely jack up your estrogen levels?
Oh yeah. Oh yeah. I did that to myself years ago.
So you get men with man boobs if they're drinking a lot of soy lattes, right?
Yeah, so bad. I broke out like a prepubescent boy when
no.
I was on my little soy kick.
Yeah.
So yeah, you don't want to mess with that. And then the cruciferous vegetables, you just want to cook them. You don't have to avoid them, but cruciferous vegetables like broccoli, cabbage, cauliflower, they have goitrogenic compounds in them that are more present in the raw state. So just saute them in some C60 olive oil. You know what I mean? Steam them up or something.
We don't cook with
break
the
it down.
oil. But
We don't cook with the
you
oil?
can-
Oh,
no,
I
you
cook
can
it.
steam it and then you could drizzle it on
And
afterwards.
then drizzle it on.
Yeah.
Okay,
yeah.
I like
You don't
that.
want to cook with it.
Okay. But
Yeah.
you can cook with MCT oil. That's more of a high heat.
Well, not with C60 MCT.
Okay, so you don't want to break down the C60. That's true.
Yeah, you don't want to oxidize anything. You can cook with another form of it if you want, but I really just like to steam my broccoli. That's just a preference.
And then drizzle.
And then I drizzle on afterwards. All right.
Perfect.
What are some of your favorite supplements to support thyroid health?
See, I love iodine, and this
Okay.
is very, very controversial in our functional world. There are a few people that say to avoid iodine, but I just look at the science.
What's
Iodine
the
is-
form like that you take with it?
So I really like nascent iodine. I really like nascent because when I dove into the different types of iodine, nascent is more bioavailable and it's more beneficial to the thyroid. So we literally just came out with iodine fixer this week and I have been trying to source the perfect, most clean, unadulterated, no heavy metals, just beautiful source of nascent iodine, and it's hard. It's taken me 2 years to do so, but it's finally time. So I really like the nascent iodine, and I always tell people you start slow and work your way up. And this is because iodine is antiviral, antifungal, antibacterial. It lowers reverse T3, so it helps with conversion of T4 to T3. It helps your thyroid gland produce more thyroid hormone. I mean, when you look at the basic science of iodine, it's like, wait a minute, why are we taking this exactly? It helps with fibrocystic breasts, it helps with fibroids, it helps with hair loss. So it does so many things. I really, really love iodine. Vitamin D, magnesium, those are just basic precursors. Selenium, they help with the conversion of T4 to T3. So keeping your levels adequate there. And then you can start going kind of down the little mini specialty route. Black cumin seed oil, we talked about that on my podcast too. Huge anti-inflammatory, helps to lower Hashimoto antibodies. Throwing in C60 for the health of the cell and basically all things, all the symptoms associated with hypothyroidism is key, from hair loss to low energy, brain fog, all of that. I mean, that's just going to help the whole system overall. So that's really what I like to start with. And then we get more nuance, like if someone has insulin resistance and how that relates to the thyroid. But those are the basic supplements.
Nice. So you mentioned C60. What has your personal experience with C60 been like? What have you noticed?
Well, I've been using it for years now because after I learned the benefits, I'm like, all right, well, this is part of my everyday stack. And then I started using it with my dog. So I'm walking around optimized, right? So I don't really even notice those little shifts that most people do if they're sick or they're low energy. And then they're like, holy cow, my brain's lighting up. But I go more by what I've seen in my dog and then my anecdotal evidence from my patients. So specifically with hair loss, whenever we have someone that's suffering with hair loss, I will start them on T60. And that is one thing that really within a month or two, they start noticing the changes in their hair, the quality. It stopped falling out. It stopped breaking off very easily. So they notice that shift right away, which there's not a lot of hair stuff out there that we can say, oh my gosh, it has this immediate effect on the hair follicle. With my dog, he's 14 years old. You and I talk about this all the time. We want our pets around as long as we possibly can. And he was really having trouble with jumping up. Like he used to spring up on our bed. So I had to get him little stairs. He used to spring up in my Jeep. Now I got to lift him up. Well, not anymore. So when I started using C60 in his food every single day, now, like just the other day, I looked, I'm like, whoa, I just saw you jump up there and it's pretty high. And now he'll just kind of jump right up into my Jeep. So it's really cool to see the changes because like you said, animals don't have the placebo effect.
Yeah.
So it either works or it doesn't work. And it's kind of cool when you use it on your pets because then you go, okay, maybe I should be using this a little bit more because I see a difference in Riley, Yeah.
I love it. Well, Amie, this has been a really fast, fun, furious conversation to dive into all things kind of like Thyroid 101. Thank you for enlightening us. Any final words of wisdom or parting advice for our listeners if they feel like they might have some of the things that you mentioned about how to proceed, move forward, and find the right type of support for all things thyroid health?
Well, yeah, I mean, the biggest thing is to have hope that things can change. Do not believe any words thrown at you that, well, you're just getting older, it's all in your head. Pick up on those signs and symptoms that your body is giving you and don't discount them because it'll get louder. I mean, your body will start to scream at you if you dismiss them. So listen to them. Take the right approach to get thoroughly tested, work with someone that knows what they're doing, and just have hope that things can change. And just for your audience too, we created this really cool tool. It's at dramie.com/labs. And we've been working on this for a while because we get this question all the time. Will you look at my labs? Will you look at my labs? So obviously I can't look at everybody's labs. So we created this tool where you can, once you have the labs, and you can do this with half-ass labs, you can do it with full sets. We have hormones in there, we have insulin, we have glucose. You can literally go through this tool, and as you are entering your answers for your labs, it gives you immediate feedback as to what that means. So that's really going to help take you to the next level so you know what your labs mean, and then you can have that conversation with your doctor as well.
Awesome. Amie, I really appreciate your time today. I know you've got to go, so I'm going to let you go, but we're going to put all of your information in our show notes here, and we're also going to pop it up here. So if people want to get in touch with you and learn more about you and the great work that you do as the thyroid fixer, they can reach out directly. Thanks so much.
Thank you so much. Thank you.
Bye.
Power in your purpose.